And good evening, I'm Bart Bedsole.
And I'm Heather Skold. Thanks for making us your choice for your news at 10 o'clock. Tonight, we take a deep dive into the mortality rates tied to COVID-19 here in southern Colorado.
El Paso County reported just one death over the weekend period, something that would have been quite remarkable just a few months ago. And with just 81 positive cases over the past 3 days, El Paso County is making good gains in the fight against COVID-19.
Pueblo added 13 cases over the weekend, while Teller added 5 more and Fremont added 1. But that death in El Paso County was the only one reported in our region. Now, as for the data we are examining tonight, one key figure COVID researchers like to look at is the infection fatality rate. That is the number of deaths divided by the total number of confirmed cases.
To find an updated rate, we looked at the number of Colorado cases from early July to early August and the number of Colorado deaths about a week after each of those days. Our analysis found the fatality rate has steadily dropped. So tonight we're asking, why aren't people dying from COVID-19 at the same frequency as earlier in the pandemic? Several months ago, if you made it out of the ICU after contracting the coronavirus, you could expect something like this: a send-off from the staff to recognize you beating the odds, because it just didn't happen all that often. Dr. Christopher Merrick with Pulmonary Associates works with only the worst cases at UC Health Memorial and says in the early days of treatment, only 10 to 15% of COVID patients in ICU would survive. Today, that number is more like 40 to 50%, so the outlook for the most seriously ill patients is much better than it was.
If we were to transport them in time back to February, March, April timeframe, they probably would have died from the disease. That now we are able to salvage them and get them through. And I think that points to the fact that we're having a much better understanding of how to treat the disease.
The more recent changes in treatment include delaying ventilators, not using them in the beginning as was initially recommended. Also, the use of Decadron, a steroid that helps people suffering from low oxygen levels, as well as remdesivir, which has been a great help to some of Merrick's most critically ill patients. And finally, the use of convalescent plasma, blood with antibodies donated by previous COVID patients, an experimental treatment President Trump just spoke about Sunday after it received emergency authorization from the FDA. During the worst of the outbreak in New York City, the infection fatality rate was believed to be around 10%. According to the El Paso County Health Department, the overall fatality rate locally is 2.6%. And our analysis found that from July to August, the statewide rate was around 1.3%. Dr. Merritt compares the battle against COVID-19 to rock climbing, believing that while we have probably moved past the most challenging section known as the crux, there is still some work ahead.
I think that the general public in this community should take hope that we seem to be pushing this thing in the right direction in terms of our medical treatment and our community health management. But if we've learned anything about COVID, it's that it's very hard to forecast what is going to happen.
Doing a better job of protecting the most vulnerable, including nursing home residents, is believed to be another factor. By the way, even if the current case fatality rate of COVID-19 is down to around 1.3%, it is still far deadlier than the seasonal flu, which has a fatality rate of about 0.1%.